Welcome, everyone. To start today, we're going to hand it over to President Angelica.
Hi, everyone. My name is Angelica Marota. I'm the president of the Rotary Club of Silicon Valley. And today we are hosting a special program regarding healthcare, because as you know, this year we are focusing on healthcare and all the related issues. And our mission is to spread awareness regarding the common issues and how members and friends can relate to some of the common things that can happen these days. And this is a great opportunity to learn more about mental health and other related issues. So I'll hand over to Rushton for handling the rest of the meeting. Thank you.
Wonderful. Thank you, President Angelica. So welcome, everyone. This is, as you know, the Rotary E-Club of Silicon Valley. We are a set of people who are dedicated to making the world better around us. And as part of that, we have members in a dozen different countries. And so if you are joining us as a member or a guest, we appreciate you taking the time. Rotary International, 1.4 million members around the world, Rotarians and Rotaractors, and all working to make their communities locally, globally, and digitally better in some fashion. Our speaker today is Dr. Laurie Theeke, and Dr. Theeke is a professor at the George Washington University School of Nursing. She's the associate dean for the doctoral program in nursing, and her research has focused on helping lonely people who are transitioning home from long-term care or living with chronic health conditions. If you'd like to read her full bio, then feel free to pause. And if you are on our YouTube page, scroll down a bit to where that is in the comments area. If you are on the SiliconValleyRotary.com page, pause and then scroll up to where the intro is above our embedded video. Dr. Theeke, we are so happy to have you with us today. Thank you for taking your time to tell us about your work. Welcome to the Rotary E-Club of Silicon Valley.
Thank you, Rushton. I'm actually very excited to be invited to this group. My father-in-law was part of the Rotary, and I'm just one of my favorite things to do is to talk about my research with people that might actually be able to do something with it and make a difference. So I'm going to share my screen now. I have some slides, and we will proceed here, and I'll talk to you about my work and then take questions. I am a nurse practitioner, just to let you know. I'm a clinical specialist in geriatrics, and I've spent since 2003 studying the problem of loneliness and how it relates to human health. And that stemmed out of a clinical experience where I had students saying that all my patients came to me because I listened and they were lonely. So that's sort of how I got interested in this topic. And I also have worked extensively with the foster care system, and I actually live and reside in West Virginia and work for George Washington. So I have a lot of experience with rural people as well. So today I want to talk to you a little bit about things you might recognize as predictive of loneliness or isolation, how people respond to loneliness or isolation, and then how that might actually be a pathway to poor health. And I'll talk to you about some of the interventions that have been used and tested, and I think that you would find interesting. So we're going to begin. So my work with loneliness started by thinking about the basic human need for love and belonging. And this is a need that's been in the literature since the 1950s. And there was a nurse scholar named Hildegard Peplau and Maslow that all started to write about how human beings need socialization and they need to fit and belong and be loved in their environment. And when they don't have that need met, they can feel lonely or they can feel isolated. And when that happens, it leads to other problems. So we've been working on this science for a while, and we still don't have it solved. This is a particularly good time to talk about it, because if you never were lonely or isolated and just lived through a pandemic, you might have a sense about what I'm talking about. Having lived through the social isolation of the pandemic, it really created a lot of problems for people across populations. So one of the important things to know is that loneliness and social isolation are different concepts. Loneliness is really the perception that your unique human personal need for love and belonging isn't being met. Social isolation is when you are literally isolated. You have limited resources, limited contact, inability to be in touch with other people. They are two different concepts, and they are both very prevalent. I put some statistics here on the slides for you. Very common in seniors. midlife adults and school children. And also in Appalachia, the prevalence is very, very high, which is where I usually live and do my research. I want you to know that they're different, but I also want you to know that both of them are linked in many, many studies to very poor health outcomes, multiple medical conditions, functional decline, and mortality. So we need to study them both, and we need to know what they are and how they impact health. These are some of the predictors on this slides that are linked to loneliness. So you might even see some of these predictors in your members. And so I'd like for you, if you see this, to recognize this is a person that might become lonely. If you see a person who's struggling financially, or maybe didn't have access to good education or good health care, all of these social and structural determinants of health we know contribute to people feeling marginalized, lonely, or isolated. In addition to that, people who are maybe single, widowed, unmarried, have limited social networks, or have that rural living piece. And one of the other interesting things is also people that live in high crime areas can be very lonely because sometimes they don't go out, especially seniors, out of fear. And that can make them more likely to be lonely or isolated. So I picked these two pictures for this slide because I've seen some of this posturing in very lonely people where they are almost hugging themselves. And this happens across the lifespan. So I really want you to be on the lookout for this. When people are very lonely, they do respond to it. It is a condition, a stressor. I call it a biopsychosocial stressor. And people respond to that in biopsychosocial ways. So very lonely people, or people I've studied that are very high lonely on the loneliness scales, they are experiencing a physiological stress response, a little bit like, not exactly like, but a little bit like that fight or flight, where they are very stressed, having stress hormones circulating in their body, and this can alter your brain function. In addition to that, very lonely or isolated people have higher levels of worry, fear, anger. They may have changes in sleep habits, decreased optimism, and they may not believe in themselves as much. That limited self-efficacy and diminished self-esteem when you're very lonely and don't feel like you fit in or have the support you need. They also may not eat regularly. We know this about a lot of seniors. Eating is a very social habit. And so sometimes people that are very lonely don't eat regularly. They don't exercise as much. And we also know, particularly in my area, it's linked to increased tobacco use. And we know that lonely people are more likely to relapse into substance use, particularly with opioids. So one of the most interesting things about lonely people is that you might not expect it, but they sometimes self-isolate. Lonely people and isolated people sometimes have a perception of rejection or so feel like they're not socially desirable. And so they might actually self-isolate, not reach out. And it's important to know that, because if we see a person that looks lonely, then what we want to do is reach out to that person and be proactive, because they may not have the ability to reach out to you. So the other thing I want you to remember is when a person is responding in this way to a psychological stressor, it is linked to poor health outcomes. Many, many, many studies, and I mean thousands, have told us that loneliness is linked to hypertension. More recent literature tells us loneliness is linked to metabolic syndrome, which is a precursor to type 2 diabetes. And then in addition to that, high lonely people are more at risk for stroke because they have higher blood pressure, and they have psychological diagnoses like anxiety, depression. Lonely teenagers are more likely to express suicidality than non-lonely teenagers. And then behaviorally, it's important to know that while they're lonely and isolated and having these stress responses, they also may not be able to self-manage as well. So if you have multiple chronic conditions and lower ability to adhere to your medication and self-manage your problems, you're not likely to have a good outcome with those illnesses. So I want to talk to you a little bit about interventions, and you don't have to read everything on the slide. I put some information here. Basically on this slide, I want to tell you, we've tried some interventions. I'm going to have some more coming up on the next slides. And then we've done meta-analyses and reviews of interventions and systematic reviews of interventions. And what we've learned is that some of these interventions I'm going to talk about are helping with social isolation. We've yet to identify or test and demonstrate effectiveness testing for an intervention that has sustained help with loneliness. And that's where I come in. I'm working on intervention development with other people now. So what has been tried? I'm sure that's on your mind. So many things. Psychologists, health science researchers, social science researchers have tried individual interventions, combined interventions. We've had studies of Tai Chi with therapy, exercise with crafts, home care with education, animal therapy, group counseling. There's been occupational therapy guided treatment for functional improvement, individual studies of exercise and music therapy, reminiscence therapy, social interventions like trips and dinners, and then your basic cognitive behavioral therapy and psychotherapy, both group and individual. And what we're seeing in all these studies is that some of the most effective interventions are animal therapy, group session type interventions, and CBT, cognitive behavior therapy based interventions. That's what CBT is. So I want to share with you, though, some of the innovative tech interventions that are coming out in some of the newer research and, where this is kind of headed. We were forced in a pandemic to move towards some tech-based interventions, and that's been really interesting to see. And so people started exploring all kinds of ways of connecting people using technology. And so, of course, the first one was all these various portals and video chat devices, like the Amazon Echo and Facebook Portal and there's one called the GrandPad for older people. And people were using these devices and reporting that they were linked to a more positive affect, enhanced feeling of connectedness, and some diminished loneliness for the short term. We didn't have that long-term sustainability, but they help. So that's something to remember if you have an older relative that's alone, maybe try that. The other thing we're trying is some robotic interventions. There's LEQ. This is more like a digital home companion. It has a camera and voice and uses artificial intelligence. 80% of the older adults who use LEQ are saying they feel less lonely. It's also a little bit of a digital assistant. It'll help you with your appointments, help you secure rides, tell your loved ones if you need help, and can set reminders for appointments in medicine. So in some way, it's a support system in a robot. Pair is a little bit different. This is a therapeutic robotic biofeedback seal, and they're testing it in lonely people with like mild, moderate dementia. And it is seeming to have good results for helping people with those diagnoses feel less lonely. So the other thing we're trying is the bots and VR options, I call them. There's one that stands out in the literature. It's the Wobot, and this is a CBT-based chatbot. It was developed at Stanford, and it really helps people analyze their moods and learn about themselves so they can sort of learn ways to self-correct. And the other one is this VR option that was developed using the VR headset to help lonely people connect with others using virtual reality. And it's being employed also to help seniors who've lost some function maybe have a virtual experience for things on their bucket list that they can no longer attend to physically. So it's really an interesting development, and it seems to be getting some favorable reviews from some midlife and older adults. And it'll be interesting to see where that goes as far as loneliness and social isolation are concerned. It is letting people connect with relatives like for dinner in a virtual experience. So that's interesting. So the next thing I want you to know that I think has real clinical utility are the apps. One is the first app I want to tell you about is the Pix Health app. I am working a little bit with Pix Health, or will be in the future, to refine the app. We're having some discussions now, but it's not, Pix Health app is not just an app. It's an app that gives you some companion support and activities, but it's a multi-component intervention that also has many employees who call and check in on lonely people. And so it's an interesting development where we have some tech support with some real support, and it seems to be having favorable outcomes. You can go to the Pix Health website and see that people who are using the app across the lifespan seem to say it's helpful. And of course, the other app that's been around for a while is the Happify app, and it has lonely modules in it. And the Happify organization is reporting in some studies that for people that did their mindfulness and gratitude skills, those people are having less reports of loneliness. So those are two interesting apps that you could try or recommend to people if you know they're lonely. And then the last intervention I'm going to tell you about is the Listen intervention. This is an intervention I developed. I developed it with funding from the Robert Wood Johnson organization, the Robert Wood Johnson Foundation. And this, I originally designed Listen to be a face-to-face group intervention that affords people the ability to talk about their experience of loneliness, do some writing, do some homework, move towards healing, find a meaning in the experience, and find unique solutions for themselves. The pandemic kind of took down our ability to meet face-to-face in groups. So now I'm in the process with the team to write for fund. We're writing proposals for funding to see if we can transition Listen to online. Over the last 2 years as a nurse practitioner, I've had the opportunity to participate in telehealth. And so we've developed some of those skills and platforms now where there's quite a few opportunities for behavioral and psychological health interventions to be delivered online. And so that's where I think we'll be headed there with Listen. And so my last slide is really just to tell you about national organizations where you can go to get information. The first is the Coalition to End Social Isolation and Loneliness, and that's based in DC. And they're a policy organization aiming to disseminate research findings, develop and advocate for federal and state policies, and lead public awareness about loneliness. And then we have the Foundation for Social Connection, which is an organization aiming to help translate research into action. And they may be having some funding opportunities for young junior scholars. The Campaign to End Loneliness is again about awareness and policy. Then there's Commit to Connect. And the National Academies of Science, Engineering, and Medicine took on producing a report on the significance of loneliness and social isolation for older adults. And there's a link on the slide to this report, which gives you extensive information about the current state of loneliness and social isolation for seniors. So that is my presentation, and I hope that was helpful to you.
Wonderful, Laurie. Thank you very much. We'll leap into questions and answers. Before we do, though, I would like to introduce the people that we have as part of the recording today. If you are in a position to have your camera on, feel free. If not, no worries. We have a couple of guests with us. We have from the Rotary Club of Eugene Metropolitan, Heather Edwards, friend of the club. Heather, good to see you. We have from the Rotary Club of Palo Alto University, Sunrise, Elton Sherwin. So good to have you, sir. We have a number of our members from around the world. Wave when your name is called. Our secretary in Sacramento, Mike Kane. The ombudsman here in the Bay Area as well, Phil Dean. Our membership chair, Alexandra, in Germany. Our president, who spoke to you earlier and who will launch the questions in moments, Angelica. We have our treasurer, who is also in Italy, Angelica and Cecilia, both in Italy. And we have our paella master, Shags in Walnut Creek. My name is Rushton. I am the programs chair. And one of the reasons that I am regularly grateful to the large universe is that I get to hear from wonderfully interesting people like you, Laurie. So Angelica, I'd like you to unmute and ask your question, and then we'll start our way down the list.
Sure. Yeah. First of all, I wanted to thank Laurie for this interesting presentation. It's so important to raise awareness on this kind of problems, especially after the pandemic. You also mentioned that this was an important problem to address during this difficult time. And you also mentioned another interesting thing is that loneliness and health are connected, and there may be long-term consequences arising from being lonely for a long time, I guess. So my question is, so what advice do you have for people who find themselves feeling isolated or lonely and recognize the early signs to avoid reaching a point where it's too late, or maybe it's too difficult to address this kind of consequent issues that may be that may arise later in the years, maybe?
Yeah, I mean, it's a really good question because, it's become, recently, really over the last 2 years, loneliness has become, it's really identified and declared a national and global health priority by the World Health Organization in the US. So clinicians are being pressured a little bit to be asking people and assessing for this in clinical visits. But if you recognize yourself to be lonely, the first thing to do is to realize, and it's hard to do, is to realize, I would say you're not alone in your loneliness. And to realize that many, many people suffer from loneliness. And what I have the people do in my listen group is we start at thinking about times in your life when you feel like you weren't lonely and you did really have your need for love and belonging met. And I've had some really interesting people participate in the listen groups, and I'll give you some examples. Like I had one lady who recognized in the groups that she was lonely, and through the process of thinking about it and exploring mutuality in her relationships and her place in community, she realized that in order to be less lonely, she needed to move closer to her daughter. And that's what she did. And she lived the rest of her life near her daughter. And I'm talking about someone who was 83 when she came to my group. I've just had some really, really interesting people show me that through thinking it through and exploring it with other people, you can make a plan for yourself that's about you, that helps you to be less lonely. And so I had another lady who joined an exercise class and lost about 50 pounds. And she told me, she said, I need to find a spouse. And she did. And she actually brought him back to the school came back to the school to meet me. So she just really, really, I think what we need to do is bring them down. And we need to reach out to lonely people. And I know I'm one of those people. If I see you sitting by yourself in a meeting, I'm probably going to sit beside you. That's what we need. We need people to say, how you doing today? Reach out to people when they seem to be self-isolating. If they tell you to go away, that's okay, because you still did the right thing by reaching out, because you might be able to help someone. And just by that little connection, we know that lonely people, it's not just about your close, intimate relationships, if you will. One of the activities we do in my listen intervention is we do concentric circle diagrams where we have people tell us, who's in your close circle, who's in the next circle, who's in the next circle. And we know from a lot of the literature that to be less lonely, you might need a couple really close relationships, but you also need to know that other people see you and care about you. And it's all these little connections throughout the day that can add some quality to your life and make you feel like a valued member of the community. So really appreciating not just the tight connections you might have with, I don't know, a couple people or friends, but also appreciating that conversation you have with the mailman or when you check out of the grocery store. And I believe there's some people on here in other countries, and there's at least one other country that has started a slow checkout line for the grocery store so that older, lonely people have time to talk. And I appreciate that so much, because that really tells me that they get it, that it's these little micro interactions along with feeling like people that are significant to you really care about you, that make a difference. So, yeah. I hope I answered your question, because I could talk about this
Sure.
for a long time. Yeah.
Yeah, that's great. Great information. Thank you.
Excellent. Let's move to Elton. I believe you have a question for us as well.
I'm thinking of our local supermarket having one checkout line that says, wants to talk to the person behind you, and another line that says, speed and quiet, or something. That I mean, I would get I want to chat with the people, even though I I'm not that lonely. So my daughter in her 20s, she has a group of high school friends, and they meet quarterly on Zoom. They're all around the country now, and they talk. And then I discovered that my brother in his 60s, he has a group of guys that he was college roommates with, and they meet quarterly on Zoom. I'm thinking of setting up something like that with my high school friends.
Mm-hmm.
But
yeah. Oh, go ahead. Sorry.
I was going to add one other thing. So my old Rotary during the pandemic, when everything was on Zoom, had breakout sessions, if you're familiar with those in Zoom, where there were 4 or 5, at most 6 people for 5 to 7 minutes catching up with each other. And the thing that I observed that just completely astonished me, this is a group of people that I had known for 20 years. You know, I had breakfast with them every week, and I got to know them better in a year in Zoom breakout sessions than I did in person sitting at 10-person round tables. And I don't have a theory around why that is, but even when the conversation was unstructured, there was something that strangely that happened on Zoom. So I just wanted to share that and see if you had some observations.
Mm-hmm. Sure. Well, I think wouldn't it be wonderful after this pandemic if we all declared like the year of 2023 is the year of reconnection, right? Because what you're talking about is like sustained connection or reconnection with people that were meaningful to you in the past. And that can be really super rewarding. And it can sort of take you back to a time in your life where you still fit and belong with the group, but you have that associated memory of this group that you were embedded with, that where you were valued, you know. The Zoom thing, I'm not sure, but I hear your point, because I also meet on Zoom regularly with people like you and many people at the university, and I'm not always in DC, but I feel super connected to those people. Some of it is about the attentiveness, I think, maybe just maybe it's the small group nature where you really get to know people. We do that in our listen intervention where we only have 5 as a maximum for the group, so everybody has time to talk. Right? If you get too many people in a group, you can have some people dominate the conversation, other people not have a chance to talk. When you go to that small group setting, you're more likely to get interaction from people, especially people who are hesitant in a large group, you know. So I don't know why you feel so really good about the Zoom, but I will tell you that I can relate to that. I can relate to that experience. Yeah.
Wonderful. A question that came in through the chat. Is there a way to measure how people can recognize that they are suffering, in quotes, loneliness? That I'm sure, and the questioner also adds that there are plenty of people who might not know or not want to say that they are lonely.
Right. A lot of people don't want to say they're lonely, first of all, because there is this social stigma attached to it that, you know, if you say you're lonely, it might mean other people don't want to be with you, or there's just a real stigma attached to it. And remember how we used to have the stigma of depression, and we managed to take that down with a lot of media campaigns about how many people have depressive symptoms. But some people don't want to say I'm lonely, especially to their family, because you don't want to feel like you're a burden, or that, you know, that might make other people feel bad, and then they have to come and do something with you because you feel lonely. So I get that people don't want to declare it. To answer your question about the measures, there are reliable and valid measures to assess loneliness. There are multiple versions of the UCLA scale. There are other scales that are targeted to specific populations. And so, yes, we can assess if people are lonely and how lonely people are on a range. Most of those scales, we don't really have a cutoff, you know, but we know, well, this person seems maybe a little lonely, or this person seems like they're very, very lonely. One of the things that's interesting I did in my studies, my initial studies, was I did the scales with people, and then I asked them, are you lonely? And I had so many people who had very, very high loneliness scores, but they still said no, they were not. And it really made me realize, like, oh, we not only need to ask people, we need to ask these questions to ask people. And so what's happening is some of the health systems, and I hope more of the health systems, are embedding, just like we have depression scales and anxiety scales in the electronic health records, they're embedding, like there's like a 6 or 7 item scale for social isolation that might be in the Epic Health system now. And there are loneliness scales that we can put in so that when people come for their annual checkup, this is something we should be doing. It's not only saying, are you depressed? But imagine if we had people who were lonely but not yet depressed, because loneliness predicts depression and anxiety. We could prevent, in a sense, if we could do care plans for people who are lonely before they're depressed, maybe we could prevent depression. That depression costs the country so much in the healthcare system. Not only that, it leads to so many other poor health outcomes. So, the idea would be to take on loneliness and social isolation in efforts to prevent anxiety, depression, and these other health outcomes, to not only save people's lives, but to save resources and so they can be used for other things, right? To help people be more healthy. And, specifically in these older populations, there are multiple large data set analyses from several different countries that say both of these concepts, loneliness and social isolation, are independent predictors of functional decline and mortality, meaning, in a sense, loneliness and social isolation is killing people.
Mm-hmm.
That's independent of their illnesses, other things. It still predicts mortality.
Following up on that question about measures, Heather has a question about personality and how we might read people with regard to these topics.
Thank you, Rushton, and thank you for this presentation. I'm going to try and articulate this question with respect to what you said about micro interactions. I have a social example recently where I was on a vacation with 10 people I didn't really know in my second language, and my comprehension went down to about 20% for 2 days, and I felt very isolated in this very micro, very temporary situation. And in thinking about it later, I realized they didn't ask me anything about me. They didn't ask where I'm from, what brought me here, how I met everybody, et cetera, et cetera. And I thought, it's no one's responsibility to include me, but that would have made me feel a little less isolated. And that's just within a micro situation, right? And then I thought about my mom, who's very shy, and the solution that would have worked for me would have made her feel spotlighted and even more uncomfortable and waiting for the hole in the floor to open up and swallow her so she wouldn't be in the spotlight. So with people, when you say reaching out to people, we don't necessarily know if they want to be asked questions, or kind of like what Elton was saying about the 2 lines. So are there any, I'm sure there's no perfect answer, but are there any clues in reading people if we suspect that they're lonely or isolated, how we can include them without making them feel spotlighted or targeted?
Sure. Okay, I'll give you an example. Sure. First of all, I think if somebody is sometimes very lonely people won't make eye contact with you, but sometimes they will make eye contact with you, but they won't speak. They might not speak to you. So, if you see a person in the store and they kind of make eye contact with you, but they don't say anything, I think at that moment, it's okay to say, "How are you doing today?" Just a little general comment. They can always walk away, but that probably wouldn't be too intrusive. Another example would be, I recently went to a dinner at my church in the dining hall. My husband and I were going through the line. I saw this woman just sitting by herself. And I thought, I wonder why she's sitting by herself, because there's so many people here. So I just went over and I said to her, I was like, "Is it okay if we join you?" And then that's where I learned that she was like, "Oh yes, please." And she's a school teacher, and she talked to me extensively, and had the person that was supposed to meet her for dinner didn't show up. And she's just sitting there having dinner by herself. We had a lovely conversation. I made a new friend at church. And I think it was helpful for her. And it was helpful for me. I learned a little bit about the school system, so it's and I learned that, sometimes it's hard to talk to people that you don't know and keep a conversation going. So I tend to just ask these open-ended questions, and I kind of feel it out. I wouldn't just go and pounce on someone, but I might just say something general, like, "Wow, it's really raining out there today." Something general that just opens the door for a connection or a conversation. And if they don't respond and shrug you off, that's okay. They're not going to talk. But if they do talk to you, just try to keep the conversation going for a few minutes. It might mean something to that person. It really could have some meaning in their day. I had one woman, I'll tell you this, who participated in my study, who told me that she knew she'd be okay because she went to the Sheets. It's like a 7-Eleven every day at lunch and got a sub. Okay. And I said, "Do you enjoy it that much? You go every day and get the sub?" She said, "No. But the lady that works there," she said, "I know if I don't go in one day, she's going to know there's something wrong, and she's going to call someone for me." And like people have these things going on in their head about how they believe they're going to be supported. And it's probably true. I mean, I live in rural West Virginia. That probably really is going to happen too. She's probably right, because she's taken the time to get to know the woman at like the local store where she gets her lunch sub, because she didn't have any other support. But I've just heard, I have another woman who was running like an online support group for young women who'd been abused because she was on oxygen and had a walker. But she said she knew that like if she couldn't get on for the support group, the people in the support group would know something was wrong. And she had a history of abuse. So she was adding value to their life and they were supporting her. So like I've just seen some really interesting ways that people connect and feel supported, you know, and I just think reaching out to people is okay. You know, it's okay.
I really appreciate what you say about, can we join you, instead of, would you like to join us? Because with respect to the stigma, then she has to admit that she's alone and needs somebody, right? But you gave her the opportunity to do you a favor. So thank you for that language. I'm going to file that away.
So Laurie, we'll have one more question. There are actually plenty of questions left. So once we finish the recording, I'm sure we'll keep talking. It's one of the perks for being part of these. And so it's exciting to us. With recent advances in generative AI tools like ChatGPT and similar, I'm guessing that that's a pretty rich field. I was very interested in what you were saying about robotics and robotic animals and the different apps that might be out there that are being used to help people cope with all things along the loneliness spectrum, we'll say. But have you done any work specifically with ChatGPT or Bard or a similar tool that has seemed in a way promising for the work that you do?
I currently haven't done anything with the chatbot. We've had so much talk in the university community about ChatGPT and students using it to write papers that's just about all I could tell you about the ChatGPT situation at this moment. I haven't used it in any kind of way for loneliness. The main project I'm on right now that has to do with reaching people remotely is a telehealth project here in West Virginia called the Take Me Home Project. And it's a money follows the person funded project through CMS, where we were trying to take people home from long-term care and have them still not be lonely and have them still be well. And so it's another combination intervention where, you know, they're coming home, we're assessing them for loneliness, they have access to some additional supports, we're doing in-home telemonitoring. So some of those things I'm part of, but I'm not currently in a research study using a chat option. Yeah.
All right. Well, thank you so much for the presentation. We'll wind things down and then I'll hand it back to you for a final word. But for all of you who have joined us watching this recording, thank you for spending some time with the Rotary E-Club of Silicon Valley. There are two things we'd love for you to do. If you scroll down a little bit farther on our webpage, which you can find at siliconvalleyrotary.com or rotary.cool, there is an attendance form that you can use that will generate a note that you can pass along to your club secretary if you're a Rotarian looking to make up a miss. A little farther down is the Discuss forum, where we leave comments about the program and other elements of the meeting, respond to each other, and just generally use that as one more way that in an online and asynchronous club, we connect with each other. So as we always like to do, Laurie, we hand it back to you for the final word.
Okay, I think my final word would be, first, if you're experiencing loneliness, please talk to someone about it. Tell your provider, tell a friend. Don't be thinking that you're alone in that experience, because you certainly are not. And second would be for other people, for people or members of your club. If you see a person and you think that person might be lonely, reach out to that person in some kind of way and try to connect with them, because it really could be impacting their health in a very negative way. And I think we can take this on, but it's going to take a lot of people.
Well, wonderful. Thank you very much. Thank you all for watching, and we will see you next week.